you want to look at an article with me about perimenopause? The classic symptom that most people know of perimenopause, menopause transition is the hot flash, which is experienced by most women and is moderately to severely problematic in about a third of women. Now, there's another third of women that don't experience it, but there's a third of women that experience it horribly. While most women will have an experience of hot flashes limited to just a year or two, others will experience them for a decade or more, and a small portion of these women will never be free of them. As women enter the later stages of this transition, there is an increased vaginal dryness and pain with sexy time, and well, this becomes prominent because you're losing estrogen, and this once again affects a third of the population. Unlike hot flashes, the mood issues, the lack of sleep because you can't fall asleep, you can't stay asleep because your thermoregulation is crap. If you have a hot flash and it wakes you up, you can't fall back asleep. The vaginal symptoms will not go away without treatment. And there are two stages to the perimenopause or menopause transition: the early transition, where cycles are mostly regular with relatively few interruptions, and the late transition, where amenorrhea, which means your period is going bye-bye, becomes more prolonged and lasts for at least 60 days. And so, when you tell me you still get your period and you can't be perimenopause, I say to you, your early perimenopause change, your period could be just fine and normal. Because it's not just about periods. Hormones affect so many other systems. So if you look at the straws, the stages of reproductive aging surrounding the menopause transition, let's look closely at this. In the beginning, the cycles are regular with slight irregularity with normal to variable FSH, and the ovarian reserve is low. In early perimenopause, cycles can be variable, your FSH is variable, your ovarian reserve is low. In late perimenopause, your cycles are getting further apart, your FSH is going to be high, your ovarian reserve is low. In this period, your very end game, menses have ended because menopause is reached when you are 365 days since your last period, your FSH is high, which is what you would measure in blood work, and your ovarian reserve is very low to undetectable. This is what menopause, the day menopause looks like. Postmenopause is everything after that. Perimenopause are all the other boxes you just talked about. And for the average woman, the menstrual milestone of the early transition, stage -2, is age 47. Late transition, stage -1, occurs at 49. And the final menstrual period, which is FMP, occurs at 51. The average age of menopause in the US is 51. That is the average age. Perimenopause can begin 7 to 10 years prior. Hence why these stages of perimenopause show it happens in the 40s. And this is why I'm talking about this, because the stuff you do now matters. But just so you know, there is substantial variability in the onset of these milestones. So what is the natural history of menopausal symptoms? Take a look. You can read it. So let's stop on hot flashes, because hot flashes, which are vasomotor symptoms, are like the cardinal thing that everybody knows with menopause. And that is like the big symptom in the US. Pause to read. So if you didn't read it, let me just tell you, 30 to 70% of premenopausal women are experiencing a hot flash. 30 to 70% of premenopausal women will experience a hot flash. Say, for instance, you are postpartum and your hormones are a hot mess express. But when you enter your perimenopause journey, you are going to get a higher rate of likelihood of you getting these hot flashes, okay? So this happens. It happens. The further along you get in perimenopause, the more hormones that you're erratic, your odds of getting vasomotor symptoms can happen. We don't want you to have this. I just want you to know. I want you to be informed. About 20% of women in their late 50s, 10% of women in their 60s, and 5% of women in their 70s experience persistent hot flashes. Although it does diminish over time for most women, a minority remains highly symptomatic and requires lifelong treatment to maintain a quality of life. But hot flashes aren't just annoying. Apart from their bothersome ways, hot flashes may have implications for a woman's health. Hot flashes have been shown to be linked to a reduced heart rate variability, a marker of vagal tone, and the loss of which is associated with increased cardiovascular disease. and this is why I talk about this as a physical therapist, because heart rate variability is a metric I talk about day in and day out with my patients. Vaginal dryness happens with perimenopause, menopause. These vaginal symptoms are most common in postmenopausal women, and the vaginal dryness in particular is reported to occur in about a quarter to a third of women. And vaginal dryness, vaginal irritation, pain with urination has been named genitourinary syndrome of menopause. So that stuff isn't going to go away without a topical vaginal estrogen or estrogen ring, but estrogen local, okay? So local estrogen can help this. Remember, unlike hot flashes and grumpy moods, which tend to improve over time, vaginal dryness, similar to sleep difficulties, does not get better without specific ongoing treatment. So if your hoo-ha is hurting and you are postmenopausal, please tell your doctor. Grumpy adverse mood. These depressive symptoms are more likely to be reported by women who are perimenopausal. So if you're just tuning in, I want you to know that perimenopause, menopause is a transition. These are some of the common symptoms and things that you will have happen. And there is research and there are providers, but I just want you to know because knowledge is power. You don't need to suffer. We have normalized women's suffering, and I want you to find a provider to help you through your transition.